Hi, I'm Dr. Sivranji Santosh. I'm a pediatrician. So, we all were very worried about how third wave will be, what its effect will be on kids. But as pediatricians and as parents, we are seeing now that kids are coping up very, very well with the third wave of COVID. Most of them are having fever for a couple of days. Some of them are having high fever for a day or two. A few of them are requiring hospitalization for nebulizations, a few for dehydration. Some of them are having seizures, especially in the age group of 6 months to 6 years. Uh, and these seizures can happen with any viral illness, it's not specific to COVID. In addition, some older kids were observed to have seizures when the fever was high, and some of them are having vomiting and diarrhea. So, all these things can happen with any other illness too. Okay, so to summarize, kids are coping up really well. Most of them are doing really well, and hospitalizations are hardly any, especially if parents are competent with giving the right first aid to their kids. And the hospital duration, I mean duration of stay in the hospital, is also very minimal, and we are not really seeing COVID pneumonia or the related complications at the moment. Now, how does a parent plan for the care of his or her child if the child develops COVID? So, first and foremost, appropriate temperature control, not aggressive temperature control. So, just enough to ensure the child feels comfortable and doesn't throw up a seizure. So, how do you go about it? Keep paracetamol ready. Please have an idea about the dose that needs to be given to the child or baby if in case there is fever. Okay, so maintain minimum 4 to 6 hours gap between two doses. Sponge with lukewarm water, not cold water. Some children may have high fever, and even after you give paracetamol, the fever may not come down. In which case, you can keep a backup plan after discussing with your pediatrician. You can either give ibuprofen or mefenamic acid very judiciously, one odd dose, not like every 6 to 8 hourly kind of thing. These drugs have certain problems associated with them. They can increase the acidity of the stomach, they can suppress the platelets, and mefenamic acid can even lower the threshold for seizures. That means the child will be more likely to have seizures during fever than when you don't give mefenamic acid. So please avoid this, especially in the 6 months to 6 years age group, as much as possible. And these two drugs have to be used very, very judiciously, not to be given on empty stomach, only after discussing with the pediatrician, one odd dose. And if you are needing to use these medicines, please do review proactively with the pediatrician, because the pediatrician needs to know that okay, the child is having high fever, he is requiring these extra medicines other than paracetamol to control the fever. So do I need to check the child directly, do I need to test? So for these the pediatrician should be kept in the loop. Okay, then coming to hydration, it's very important. This is the cornerstone to treatment of any sick child. So you should maintain good hydration with what? Not glucose and sugar water, please. It should be plain water, oral rehydration solution. And when you buy oral rehydration solution, please do not buy any ORS packets where it's not mentioned that it's WHO recommended formula. If you go for these packs where it's not mentioned it's for WHO recommended formula, if the child is having diarrhea, that may increase, because these things, like ORSL, Rebelans, ORS, and all, which are not WHO recommended formula, they increase the diarrhea, in fact, because of the high sugar content, and they do not provide enough salts and will not be able to hydrate the child well. So, Water, WHO recommended formula oral rehydration solution like Electral or Wallite or Cipla also has this kind of ORS. And coconut water, buttermilk, soups. With these kind of things, please maintain good hydration. And if the child is vomiting, please do not try to give solids because the child is likely to vomit again. Wait for some time and give sips of these liquids in a slow manner, paced manner. Otherwise, the child is likely to vomit again. If the vomiting persists, then please do consult the pediatrician. If the child is having loose stools also, please hydrate the child well using water by giving water, oral rehydration solutions, soups, buttermilk, etc. Okay, and remember, you can check with the pediatrician and keep the medicine which can control nausea ready with you in your first aid kit, so that you don't have to call the pediatrician all the time to give that medicine. Okay, and if the vomiting persists, obviously you're going to consult the pediatrician. Now comes to first aid for seizures. As I said, some children, especially in the 6 months to 6 year age group, and rarely even older kids, may have seizures. So please be thorough with the first aid for seizures. Okay, so in case the fever persists beyond 3 days, or the child is continuously having 102, 103, and if it's a baby is continuously having above, I mean the temperature is continuously above 100 degrees Fahrenheit, you're having to use ibuprofen or mefenamic acid, please do consult the pediatrician. Also, if the vomiting is uncontrolled, the loose stools are not getting controlled, and you're not able to adequately hydrate the child is not passing enough urine, please do consult. If the child has seizures also, obviously you need to go to the emergency, especially if it is the first time the child is having seizures. If the child is very lethargic, very drowsy, very irritable, not feeding at all, hands and feet are cold and clammy or pale and blue, or if he's breathing fast and grunting like that, definitely you should go to the emergency. If it is a child with comorbidities, or if it is an infant, please be proactive in reviewing with the pediatrician. And if the oxygen value is less than 94% also, you should definitely go to the hospital. So here parents make this mistake of, when the child is very active, they keep checking the oxygen. That's not needed. When the child is dull, not feeding well, yeah, you may check the oxygen. And anyway, when the child is dull, you should go to the hospital. And when you check the oxygen, make sure the probe is fitting properly, you see the waveforms coming regularly, then only you take the reading. Otherwise, you may read it falsely low than what it actually is and panic unnecessarily. The best thing for a parent is to see how the child is. If child is active, feeding well, pink, happy, then very unlikely that the oxygen level is low. So, but still, any doubt, it's always better to consult the pediatrician. Then coming to isolation, yes, obviously if it is a younger child, we cannot isolate him completely, but an older child, yes, we can, in another room, and for a minimum of 7 days and preferably 10 days, provided there is no fever for the last 3 days. If it is a baby or a younger child, one of the parents can isolate himself or herself with the child. If it's a breastfeeding baby, definitely mother has to be with the baby and continue nursing. And obviously, the mother needs to take basic precautions of wearing a mask and following hand hygiene. Parents also need to be aware of something called multi-system inflammatory syndrome in children. Okay, so normally also if a child is sick, if there is high fever continuously, or if the fever is going beyond 3 days and you're not able to figure out why the child is not having fever, you're supposed to consult the pediatrician, isn't it? So when you do that, keep this entity also in mind. In addition to other causes for prolonged or high fever or sickness, there is a new thing that had appeared recently after the COVID pandemic has started, that is multisystem inflammatory syndrome in children, which is more common in the age group 9 years, but it can happen with the newborn also, it can happen with an adult also. In adults, it's known as multisystem inflammatory syndrome in adults. This is because of the COVID antibodies, SARS-CoV-2 virus antibodies, which act against our own body. Okay, so this can just pass off as a fever, or this can create problems for the child in terms of affecting the blood vessels of the heart, in terms of affecting the heart and other organs of the body, and the child can become very sick if this is not identified promptly and the treatment initiated promptly. So, if at all there is high fever or fever for more than 3 days, especially associated with vomiting and diarrhea, or a full fledged rash all over the body, or strawberry like tongue or bloodshot eyes persistently with peeling of skin anywhere on the body, especially on the fingers, or if the child is really sick with severe stomach pain, vomiting, and diarrhea, please, please do consult the pediatrician or go to the emergency as needed. Please be aware of this entity. And before I conclude, I would like to tell you, children are bound to have dry cough and a little of nose block during COVID. So do not try to give this over the counter cough and cold medicines. If nose is blocked, put 1 to 2 drops of saline nose drops in each nostril to relieve the nose block. And do not give direct steam, please. There is high risk of accidents, and the hot steam can burn the airways too. So the best way to provide warm humidified air is filling up a room with steam and sitting in that room with the baby or the child. Please do not give direct steam. This warm humidified air will soothe the airways and help with the dry cough. Beyond this, please always consult a pediatrician before you medicate your child. And in my next video, I'll give a more detailed account about MIS-C, and also about how to plan if a parent gets COVID, um, how to plan for the child. So these are the videos I'm going to come up with next. And yeah, I hope I've covered everything, and I hope parents will handle this third wave with less tension, but with more awareness, more confidence. um, all the best, and I am really hoping that this wave doesn't affect our kids more than what it is doing now. Thank you.